I'd like to ask Karen Williams of Brightview Senior Living to share a little bit about their communities. Thank you, Karen.
Hi, everybody. I hope you're all doing well. Thank you so much for joining us today. Hopefully you can see my screen that says, thank you for joining us. And
yes, we can.
Okay, thank you. All right, well, thank you so much for joining us. My communities and I, the folks at the communities and I decided that this would be something that would be helpful for anyone who has already been thinking about independent living at our communities, whether it's something that you're thinking about for yourself or something that you're thinking about for your loved one, and how that looks right now. You know, a lot has changed over the last couple of months, as we all know, and are probably right now in this moment experiencing. And the next steps may seem uncertain to some. So I wanted to give you an idea of what Brightview is doing. We're still very focused on ensuring that we are a great place to live and a great place to work. And as I dive into the next couple slides, just full disclosure, as you all know, things happen and change very quickly these days, and some things that I'm telling you now could be different, who knows when, but likely for the better. So the good news is that over time, we've been able to start working with the, let's see, got a note about a volume. Let's see. Can you hear me okay? Okay, so
yes, we can hear you, Karen.
Yeah. Okay, all right. So first and foremost, since all this began with COVID-19, Brightview's focus has been taking really, really good care of our residents. And personally speaking, I know that I'm just so incredibly impressed by the way that our home office team and our leadership in each community have been extremely proactive in the way that they've responded to just how many things we've had to do and how many things we've had to change in order to truly take care of our residents and really our associates as well. To give you a couple examples, right away, I want to say back in March, we made the hard decision to close the community to all non-essential visitors, and unfortunately that did include families, which was a hard decision for us to make, and our residents certainly miss their family members. The nice thing that has changed in the last couple of days, actually just since last Friday, residents now can see their family members outside, socially distanced and with masks on, of course, but it has been a nice change for them. What's happened, which has been really interesting to see, is that our caregivers and our associates and our department director team have more so than ever stepped up to be that family member for our residents, and have kept lots and lots of really great stuff going on at the community. So our residents, independent living residents, assisted living residents, or personal care, and our residents who are living in Wellspring Village are still getting any delivery that any family member is bringing to them. They're still getting their meals every single day, so they're still eating really well, and we're ensuring that they're taken care of in that department. Of course, we want to make sure happy hours are still taking place daily, so our associates have been very creative. Here's a good picture for you of how we can do different themes for happy hours and still maintain safety and keep our residents still having a good time. And then we've been working very hard before our families can visit, but even now, to ensure that our residents are visiting with family members via FaceTime or any other platform that makes sense to them. We also, I don't know if anyone saw the news recently, but we had an exciting car parade, and a lot of those have been happening just, again, to bring our residents out of the community and socially distanced, and family members drove by and got to say hi, and even the dog made it in this picture. And we did a Brightview Avondale, we did a Preakness, our own version of Preakness, where you can see our associates were dressed up in inflatable animals, and they did their own race, again, for our residents outside. So lots of different ways. I mean, I could go on and on, but I know you logged on to hear more from Jen. But I again can't say enough how impressed I've been with our residents and how they've taken so well to the changes that we've been forced to make in order to keep them safe, and our families who have been understanding and really have voiced the peace of mind that they've been experiencing, knowing that their loved one is in one of our communities and being kept safe and healthy and engaged, and really in a much better situation than some folks being at home in total isolation. So with that, I do want to let you know that we do have many communities. We have 41 Brightview communities through 8 states, all the way from Virginia up to Massachusetts. I have a picture here just of my communities. So I know some folks on the phone are familiar with these Brightviews. So Brightview Towson, Mace Chapel Ridge, Perry Hall, White Marsh, in Baltimore County, and then moving up to Brightview Avondale and Brightview Bel Air in Hartford County, Brightview Westminster Ridge in Carroll County. And then I do have 2 communities in our Pennsylvania market. So one is in the Wayne area and one is in East Norriton. So my information is here. I'll share my screen at the end of Jen's presentation so you can write this down, and please don't hesitate to give me a call or email if you have any questions about next steps for your loved one or for yourself. And again, I can't say enough about how Brightview has done such a great job ensuring that our residents and our associates are, even in this uncertain time, experiencing how we are a great place to live and a great place to work. So thank you so much, and I'll hand it over to Jen.
Thank you, Karen. I appreciate it, and we appreciate you sponsoring today's program. Before we jump in, I just want to give you a little bit of information about our presenter today. Are you considering moving to independent living? Are you trying to help an older loved one make this choice? If you answered yes to either of these questions, you are in the right place. Our presenter today is the author of Cruising Through Caregiving, Reducing the Stress of Caring for Your Loved One, and a longtime gerontology instructor at Johns Hopkins University's Certificate on Aging program. She is one of less than 800 certified speaking professionals worldwide and has been featured in national media such as the Wall Street Journal, Reader's Digest, U.S. News and World Report, CBS, ABC, and many more. When she's not working, she spends her time fantasizing about when she will be able to wander the aisles of TJ Maxx and Marshalls without a mask. Please join me in welcoming from Kent Island, Maryland, Jennifer Fitzpatrick, MSW.
Hi, everybody. Stephanie, if you would please enable me to be able to start my video, because that is disabled, and I want to make sure to say hi to everybody and share my camera if I can.
Of course.
So welcome, everybody. So happy that you're here. I saw people coming in from all over PA and Maryland. We're so excited to welcome you today, and thank you again to Brightview. This is an absolutely crazy time right now, and a lot of people back in March, I know when all of the shutdown began, they put their plans on hold. If they were considering moving themselves, maybe to an independent lifestyle, like at a Brightview community, maybe they said, maybe this isn't the right time right this minute because of all this uncertainty, unknown. We don't know everything that's happening. And I think a lot is changing. We're getting a lot more information. We've had a lot of time to really consider what's going on and what's happening. So today is about where do we go from here? So right now is it possible for us, if we want to move, is that a good idea? And how do we weigh it? And if you happen to be an older loved one who, maybe you have an older loved one, you're a family member, adult child, and you're thinking, you're trying to encourage a loved one to move, you think it might be the right thing for them. But this is also geared toward if you are a person that is a retiree and you're looking that maybe this would be a less stressful experience moving to independent living. So we're going to not only talk about how to make the decision, but we're also going to talk about if you want to talk about it with your loved one, whether you're the person who's considering moving or whether you are the friend or family member of someone who you think might be benefiting from moving, we're going to address for both of you. And there goes my camera. Hi, everybody. Glad to see everybody today. Thank you so much for joining us. So let's jump right in. So the first thing we're going to go ahead and do now is a quick poll. So I'm going to ask Stephanie to put up this poll about, and again, whether it's you or your loved one, the possibility of moving. What attracts you to the possibility of moving to an independent living community? And you can check everything that applies. So for those who are joining us by phone, safety, security, physical health resources, mental health support, meeting new people to be around others, more stimulation, activities, hobbies, classes, access to transportation. So just pick all that apply. If you're considering it, what is attractive to you? And we'll give Stephanie a few moments to go ahead and tally that up so we can give you all the results. And just to remind everybody, if you did call in on your telephone, you will not be able to see the screen. I do see a couple questions about that. So if you called in, if you dialed in on you clicked on the Zoom link on a smartphone, you should be able to see the screen, however. Okay, interesting. So 100% are saying safety and security, 75% of you for health, physical health resources, 33% of you are saying for mental health support, 75% meeting new people, be around others, 75% say more stimulation, and about half of you say access to transportation. Great. Thank you so much for sharing that. That gives us a really good idea of what you're looking for and what's important to you. So thank you for participating in that poll. So I'm going to ask you to do one more poll. And I just want to get an idea of where your head is today. So today, which is, if you're enjoying us on this live version today, it's May 28th, 2020. What is your mindset? So is it A, my loved one, or I, depending if you're the loved one or if you're the older prospective resident, you're ready to move to independent living in the next 30 days. B would be you were ready to move this spring, but now you're having second thoughts because of the pandemic. C, that you'll probably be ready to move in the summer or fall. And then the last one would be you don't have any plans within the next 6 months to move, that you're going to stay put. So if you would just tell us, just pick one and just let us know what is your mindset right now for either yourself, if you're the one that's considering moving, or for your loved one. Looks like Stephanie's okay. All right. So most of you are saying right now you're not quite ready. And then some of you are saying that you do have, you were ready, you were all ready to move in the spring, but because of the pandemic, you're having second thoughts. Okay. So thank you so much for sharing that mindset. We really, really appreciate that because it's nice to know where everybody's headspace is. So today is about just examining what might be appropriate for you right now or in the future, whether it's in 6 months, whether it's in a year, or whether it's in maybe this summer or this fall. So most of you have indicated that there are major needs that could be met for you if you did move to independent living. And every single person said that security is at the top of mind, security and safety. And so many of you said having access to health care, that it will impact your physical health. That was another one that was really big. And then the other big one that 75% of you said that was really important to you was ability to meet others and engage with lifestyle activities. So I think we saw from Karen that a lot of that is still going on, and we're going to talk about that as well. So now it's time to talk a little bit about what your definition of quality of life is. So I'm going to give you an example of a celebrity. You might recognize George Takei. He was made famous by Star Trek, and he was on a lot of shows like Heroes, and he's been on Broadway. He just wrote a children's book. He is in his 80s, has 10+ million followers on Twitter and Facebook, when a lot of people in their 80s don't even use social media. So his idea of quality of life might be different than yours, or it might be similar to yours, that maybe you're very active on social media. Maybe you're somebody that's still pursuing artistic passions that you've had. Then perhaps your idea of quality of life is a little bit closer to that of my grandma. So this was taken of my grandmother a couple years ago with her very best friend. They always acted like young girls when they were together, and always made me laugh. The way that they made each other laugh, it's one of my favorite pictures of my grandma. But my grandma did not have any interest in being on social media. My grandma didn't care at all about working when she was retired or even doing any volunteer work. She just wanted to enjoy family and friends, go out to eat, enjoy activities, play Scrabble. She just loved just the engaging with family and friends and being around other people. And of course, health was important to her. So her idea of quality of life was different. So I'm wondering, for all of you out there, because these are two extremely different examples of what somebody's idea of quality of life is, where are you? Now, before I ask you to rate where your quality of life is today, I want you to consider your life sort of as almost a pie. So for those of you who can see our screen, you see that we have a pie-shaped diagram, and each part of the pie symbolizes physical health, psychological health, social life, spiritual life, financial, intimate relationship, work, or volunteer. Now, for some of you, you might say, I don't care so much about the intimate relationship part, or I don't really care so much about work and volunteer. I don't care so much about spiritual, but I care about the rest of it. Or I'm not really that concerned as much about financial health. But in order for us to identify what our quality of life is, I think it's important to consider all of this. What is important to you? So if in the chat section, I would love to ask you, where do you think is the most important part of your quality of life? Or if you could pick two, what are the two most important ones to you right now? So physical, psychological, social life, spiritual, finances, intimate relationships, work, and volunteer. So I'm going to give everybody a minute to write in on the chat section. Yeah, so we've got one person writing in that that volunteering, that being interested in volunteering, so having a role, whether it's volunteer work or whether it's doing actual work, that's something that's really important to you. To one person we had just write in. Anybody else want to write in, like where they get their different social life? Okay. So it's interesting that social life comes up because it's very important to a lot of people. And I don't know that we talk about it as much when we talk about retirement and going through the aging process. Okay, spiritual's at the top of your list. Okay, great. So thank you for sharing that. So now what we're gonna do is I'm gonna ask you, and again, if you're thinking about your loved one, maybe you're an adult child or you have a loved one who you're on this program for to think about, I want you to think about what would you rate their quality of life, or what would they rate their quality of life? Okay, so so if it's either you, if you're the older person that's considering moving, or your loved one, what number? So would you say that your quality of life is 100 at maximum, the best that it possibly can be under the current circumstances with the stay-home orders, and that in a lot of places where I know many of you live, you can't really do a whole lot right now outside the home, or you can do some things, but not as much as you might like, or 0? Would you put it at 0? So for yourself or for your loved one? And when you're thinking about that number, I want you to think about what we just talked about, your life as a pie. So feel free to write in what number would you either, so we've got one person writing 60. Debbie, thank you. Meredith's saying a 40. Anybody else want to write in where they feel like their number is? So again, this isn't normal circumstances. We're talking life with the pandemic. Where would you put your quality of life? We've got Carl coming in saying that psychological and physical health are most important to him. So if at 75, okay. Thank you, Julian. Joanne saying a 40. Sally's saying a 90. Very good. Okay. So I want to challenge everybody to consider, if they believe that either their loved one or their own quality of life during this time is under a 75, what might you be able to do differently to improve that number? Now, 75 to me, I've been teaching college my whole adult life pretty much, and 75 is a C. So to me, unless you're, an 80 or above, I want to see everybody feeling like during this time that their quality of life is as high as they can possibly get it. I know it's not normal circumstances, but can it be better? And for Marlene, who says hers or her loved ones, we don't know, is at a 50, or Joanne, who says a 40, or Julian, who says a 75, what might we be able to do to move from a 40 to a 50 in the next week or the next 2 weeks? What can we plan, or what can we be doing to update quality of life? And I want you to be thinking about those areas where either you or your loved one don't have the quality of life that would make that number higher, okay? So be thinking about that. Is it something physical? Is it psychological? Is it social? Is it spiritual? Is it financial? Is it intimate relationship? Is it work or volunteer? So just be thinking about that. What could be improved? Okay, so Meredith's writing in, having a loved one in assisted living would put them higher in quality of life, but only if the pandemic fears are under control. So Meredith, that's a very, very valid point. But I do believe it's very important to mention right now, and I've been following all of this incredibly closely, that what we're seeing as far as numbers in nursing homes is typically, in most geographic areas, extremely different than what we're seeing in assisted living, senior living. So what I would encourage everybody to do who has that concern, and Meredith brings up a very valid concern, is to look at the data and ask good questions if you're considering Brightview or a senior living community. I think it's very, very important to get those numbers, and because people are, it's funny, in independent living and assisted living, in almost every jurisdiction, the numbers are incredibly low comparatively to nursing home, because it's a very different service. It's a very different environment, very, very different. And I bet that Laura, if you at any point, Karen, if any point Karen Williams would like to jump in. Laura is one of Karen's colleagues in another region of Brightview Senior Living. But if Karen would like to jump in at any point and address that, you're very welcome to jump in, Karen, or you can certainly save it to the end. It's totally
I'd love to jump in on that, because
yeah.
Where even frankly on the news this morning, I heard there's a news broadcast about nursing homes and COVID and how it's like so bad for our seniors, and it gives me palpitations, because Brightview Senior Living is not a nursing home, and I realized that a lot of times when you hear assisted living or memory care, that you do get, it gets very easy to get it lumped together. And I'm going to put my video on so you can see me. There I am. Hi. And it's easy to do that, and it's totally understandable to lump those two together. But the main difference between what we offer and what nursing homes offer is that we don't have that heavy nursing component. So when a loved one is living in a Brightview, they have a really fantastic group of caregivers. We have dining servers, we have vibrant living assistants and associates and director teams. But we don't have a nursing component where we're using the same instruments on different residents, or we don't even have patients. There are residents. So it's very, very different. I could definitely send some information out to this group about the difference between what we offer versus what nursing home is. But I agree, Jen makes such a great point that you look at the statistics, and a lot of what we're hearing is nursing home related, and definitely not what we're experiencing in an independent assisted living and memory care community.
It's interesting because I have a friend. So during this time, as somebody who's worked in this field a really long time, I have a friend whose mom lives in an independent living community. It's not a Brightview, but it's in a different state, not in Maryland, not in Pennsylvania. And my friend was, she's getting the numbers every week of how many cases. And my friend was saying, this is suspiciously low. I'm feeling like I'm hearing all this stuff in the media that, it's like, there's so many cases. And I said, no, it's just typical. And I'm not saying everywhere, but typically it's very, very different. I'm actually going to be speaking for the Texas Assisted Living Association next month. And I had a prep call with their executive director yesterday, and they were saying in Texas, which is an enormous state, in assisted living, now not nursing homes, but in assisted living, they have, in Texas, there are 2,000 members that are part of the Texas Assisted Living Association. So 2,000 communities, and only 6% of those communities even have an issue in their building. So I just one quick statistic that I can draw from. Meredith brings up, when somebody has dementia, they can't easily remember what's happening, why, reducing social interaction. And Meredith, that's one of the reasons why, that's why the staff take ownership of all of that. And I'm sure that Karen could address that. And again, Karen, if you want to address that about Wellspring Village and how that works, you're welcome to, or you can wait, whatever you're most comfortable with.
Yeah, I can answer it now. It's a great question, and frankly, it is. It's one thing for independent living residents. They understand what's happening. They realize the safety around staying in their apartment homes and staying within the 6-foot distance and washing hands and such. Certainly, when someone has cognitive impairment, that is a challenge. And one of the many things we've done is we've actually been hiring to bring in more caregivers for Wellspring Village, which is our dementia care neighborhood, so that we do have more hands on deck in order to work with the resident to help them in different ways, whatever works best for that person, to understand and to comply. Yeah, not everybody is able to do that, and we're very focused on maintaining dignity and care for all of our residents. But in order to be able to work better with our folks who are having a harder time just staying in their apartment home, and we do have more hands on deck who are able to help them and be with them and stay with them and wear protective personal equipment so that they're not endangering anybody else while doing that. That's a great question.
And this is an imperfect, we're not saying that no community was prepared for this. No organization was perfectly ready for all of this, but Brightview has done some really taken tremendous action to try to protect all of their residents. And so Meredith, I get it. It's not, I guess the way that I look at it is people are always saying, well, if I move my loved one to a senior living community, what if they fall? Possible. I mean, but it's also possible that they could fall at home. We don't want that to happen, but when there's a lot in place that's going to help to prevent COVID from happening. So again, I don't think any community can ever say definitely there's not going to be anybody that ever has the virus in our community, but they're taking every possible precaution. So if your quality of life number or your loved one is on the lower side, I want you to be thinking about, certainly there are things that you can do now, but if you did consider moving, is it possible? And some people have written in, yes, that they do believe moving would help, but they still have a little bit of reservation. So let's talk a little bit more. So I want you to talk a little bit about the consequences of waiting. So the possible consequences of waiting right now. So if you or your loved one are thinking about moving to independent living and you're saying, well, because a lot of people on that survey that I just did, that poll that I just said, nah, I'm not ready for a while. I want you to be thinking about if you or your loved one are feeling isolated or you're not around other people, is that likely to get worse staying at home? Also, the anxiety of the situation. If your loved one maybe they have an anxiety disorder, or they maybe it's not been diagnosed, but they have always been a worrier before all of this began, and having professionals working with them could be helping to mitigate. If your loved one needs medical attention, but they're afraid to even go to their primary care doctor right now, this is the sort of thing like Brightview has in place. So that getting preventive care, that they're able to, docs come to the community, their medical director, or they can arrange telehealth. If there are urgent medical needs that can't be handled in-house or with a telehealth appointment, the Brightview communities are actually taking the independent living resident to the doctor if necessary. So this is something that you don't have to worry about. Okay, well, this family member has an autoimmune disorder and this person in the family, also shouldn't be out, and who's going to drive my loved one to the doctor? So I think it's worth thinking about what are the possible consequences of waiting. This is not an easy decision. I'm not suggesting that you just say, well, the heck with it, you want to think it through. But moving is always going to be a challenge. Moving under any circumstances is going to be a challenge. So even if I told you, whoever is on this program today, that, you know what, I'm going to move you to, if you don't live in the house of your dreams, next week, I'm going to move you to the house of your dreams. You're not going to have to pay any money for it, but I'm going to move you there. And even if it's a great move, it's something that you really want to do, it's still going to be stressful, right? Any move is going to be stressful, but what area of your life, quality of life, could potentially improve? So what I'm going to do is I'm going to share with you a little bit of a different story. My husband and I, right before the pandemic, we were planning to put our house up for sale. And we'd been planning this for quite a while, and we decided that in March, it was time. We had everything set up, the photographs taken, we had the real estate paperwork set up, everything was all ready to go. And all this began. And at that time, it was the CDC has pulled back a lot on their concern about touching surfaces. They say it's a risk, but it's not nearly the risk that they had previously thought. But, and again, I'm speaking on May 28th, 2020, because I know a lot of things change. But at that time, we said, we're not going to put our house up for sale. But now that time has gone by, one of the areas of life, because one of the reasons that we really wanted to move is because we wanted a little bit more of a different layout for our home. We wanted a little bit more space. And with my husband and I both working from home, we finally said last week, you know what? It is time. We're going to put our house up for sale. So we started kind of weighing the pros and the cons. What's the risk versus what's the benefit? And so what I would ask all of you to do, and especially if you're thinking, I'm not ready right now, or I feel like it's too risky, there can be risk in staying home. There can be risk to feelings of isolation, which we're going to talk about. There can be risks to potential health issues, mental health issues. There can be risks as far as getting essential services that you or your loved one might need, because one of the things that Brightview is doing right now, actually, which is kind of amazing, they hired a concierge, an extra concierge for the communities, who actually runs errands for their residents. And so maybe you're an adult child and you live an hour away from mom, or with traffic, you live an hour away from mom, and you're trying to run over with groceries and run over with different things that, mom wants fresh bagels or whatever it is. Is it possible that both of your quality of life could be improved with a move during this time? And so again, I know it's not exactly the same thing, but the example that I'm sharing about my husband and I is that we're like, all right, we got to do some risk benefit analysis. Like, this COVID situation, the experts are telling us it's going to be around for a while. It's going to be around for a while. We're going to keep learning more about it. But if you believe that moving could be a good impact your quality of life positively, whether it's physical health, mental health, whether it's social, whether it's spiritual, any of those pieces of that life pie, it might be time to rethink and think about, where do you stand now? Or could you reevaluate another week or 2 weeks with what your state and the CDC are saying? Because if you put it off, until there's a vaccine, who knows when there's going to be a vaccine? We don't know. There's a lot of uncertainty with this. And so it's important for all of us to just still be thinking, what's going to be best for our overall quality of life? Here's what we want to avoid. So I'm wondering if any of you have taken up watching some new shows on Netflix or Hulu or Prime, or you're constantly asking your friends and family and neighbors, give me an idea of what to watch. And if anybody wants to write in something that they've watched and that they've loved, a movie, a TV show, I am all ears. But I bet a lot of us have been doing that during this time. And that's great. Watching movies, doing television shows, binge watching, it's a great way to pass the time, and it can be fun, but not all day, every day. I remember when my father-in-law retired, and he was still young, in his 60s, and that was sort of his plan. He really didn't do a whole lot except watch TV on the couch day in and day out, maybe doze, take a nap. We want to avoid that. And so during COVID, during the stay-home orders, I think we're seeing a lot of people become really demotivated, because they're like, well, I can't go to my bridge club, or I can't go to the library the way I used to, or I'm not able to meet my friends. Even very, very active folks are dealing with challenges. Yeah, and actually Joanne's saying watching the news 24/7 of COVID is not good either. I completely agree, Joanne. I really don't watch any news. I get all my information from a couple of sites, and I limit my exposure to news. We want to be informed, but we don't want to be obsessed. That's at least my opinion. But what we want is for your loved one to be engaged. And one of the things that, if you're looking for stimulation, socialization, you don't want to be isolated, Brightview is still doing activities. Now, are they the same activities that they're able to offer when you don't have to stay 6 feet apart? No. But there is still engagement. And I know that Karen will share more of that with us if you have questions. But there's engagement, people getting to know each other, you saw pictures, people going outside as groups in a safe way. They're doing activities and programs in the hallway, that it's almost like the perfect social distance space. And guess what? It's not going to be like that forever. It's not going to be like that forever. We know that the situation is temporary. We're going to find ways to cope with this.
Jen, it's Karen. I just want to jump in and agree that it's such a great point. And someone earlier had chatted about moving into a community and then having to be quarantined it's actually for 14 days. And certainly I agree, like that just sounds like, what do you mean I'm going to move from my home? into somewhere new where I'm quarantined for 14 days and I can't see anybody or do anything. And that's definitely not the case. And, number one, right now, it's such a time to start thinking about Jen's points and if and when the right time to make a move is we're actually, as far as Brightview is concerned, we're very specifically not taking move-ins right now because we want to maintain that safety for our residents and our associates. And I saw that peace of mind and physical health, and that came up a lot in the chat or in the poll. And that's something that we take so seriously. And we have competitors who are moving in people, and we're like, we just can't do it yet. We just want to make sure we're doing the right thing. Number two, when someone does move in, yes, you're exactly right. There is that quarantine period, but during that 14 days, the person isn't sitting alone in a dark apartment, not doing anything. They still have the benefit of meeting their department heads. They still have the benefit of the daily updates that the executive directors are doing. They still have the benefits of breakfast, lunch, dinner, happy hour, tea, coffee carts, all the great things that, as to Jen's point, which is why I jumped in, that our teams are working major overtime to ensure that our residents are really still experiencing physical engagement through virtual workouts, just like we're all doing at home. Social entertainment. They have musicians come and play in the courtyard, and then you can hear it or see it from your window. So again, I could go on, and I don't want to keep busting in on Jen here, but
Okay.
it just was weighing on me that, yeah, it might sound weird, like, oh, quarantine and social isolation in a community like that, but the word community, keep that in mind, because you or your loved one would not be alone, for sure. So thank you, Jen.
Hi, everyone. This is Stephanie again. I think that Jen might have lost her connection. It looks like she will be trying to log back on. She's actually going to be calling in, so bear
Sorry,
with us.
Probably me jumping in.
I don't know about that. We're having I don't know about where everybody is, but we're having some storms, so it's probably related to that, but she's going to be calling in. I thank everybody so much for your patience.
Right. If anybody has any questions while we're waiting for Jen, I'm happy to answer. One thing that if this is something that you're considering moving to one of our Brightview communities, please like us on Facebook. Our teams are working very hard to keep our families engaged, and one of the ways that we're doing that is through Facebook. So, so you'll be able to see the things in the community to ensure engagement of our residents. And someone just asked about how can I attend exercise class if I'm, I think you meant quarantine. But you would have all of our apartment homes, you would have a TV, and then we have a live stream that's able to be accessed. So I see Jen's back. So
hi, everybody. I am so sorry. I do not know what happened. So unfortunately, Stephanie, if you have I know you have the PowerPoint. It was emailed to you this morning, you and Darlene. If you're able to pull it back up, great. If not, we will just continue. So Stephanie, if you can give it a try to pull that PowerPoint back up. And we were actually at slide, 17, I believe. Oh, sorry, we were at slide 13, if you're able to pull it up. But what I would like to just talk about now is the concept of isolation and loneliness, which is one of the reasons that so many people benefit so much from senior living. And I want to talk to you. So loneliness is actually something that is self-described. So if you feel lonely, you would be the one that says, I feel lonely. Whereas social isolation is that somebody subjectively can say, okay, you're not having engagement or contact with others. Now, a lot of experts during this wild, crazy time have determined that we're using the word social distancing, but really we should be using the word physical distancing, because that's really what we're doing. And like Karen was sharing about the idea and the concept of having challenges with when you move to Brightview, you know, that they're doing this physical distancing and again social distancing. But there's a lot of data that suggests, and on slide 19, I would be at this point, Steph, if you get it up. The Harvard Business Review says that oh, look we got it back up. The Harvard Business Review tells us that if we are isolated and lonely, that it is equivalent to smoking 15 cigarettes per day. Steph, we're going to be on slide 19, if you're able to get to that. So it would be the equivalent, being isolated and lonely is the equivalent of smoking 15 cigarettes per day. Now, some of you may have seen the studies that say to us that if we are sitting too much, which you're probably doing right now, if you're sitting, that you that's another thing that's equivalent to 15 cigarettes per day. But now we're saying that is very close to what goes on if we're isolated. So again, while it's not normal times at Brightview or any senior living community, it's not normal times right now, but what we know is that your loved one or you will still be engaging with lots of others safely. They're wearing masks, they're keeping safe distance, but with the staff, with other residents. So if you or your loved one are feeling lonely, or you can identify that you're not doing Zoom calls with family, you're not doing an online book group, any of those things, there's a lot there that is worth looking at if you feel that you are isolated or lonely, or your loved one is. So now we are at 20, and I just want to talk a little bit about some of the increased risks. Some of you, Steph, we're going to just right there is perfect. Where it is right now is perfect. If you get all four of those up. If you're isolated and lonely, we are at increased risk for neglect, self-neglect, being abused physically and emotionally, also for financial exploitation. Now, many of you, Steph, if you could leave that back to the last slide, and I'll let you know when to get to the next slide, that would be terrific. Thank you so much. So with this, what I would say is that many of you, actually, no, not many of you, all of you indicated that you are concerned about security and safety. And that's one of the main reasons that you're looking at independent living. Financial scams are on the upswing specific to COVID. People going after older persons. I have the vaccine. I have the medicine in case you get sick. So this is something to be keeping in mind. If you are in a situation where you're concerned about that for either yourself or your loved one, remember that all of this, it doesn't just happen to people with dementia, especially financial exploitation. It happens to people of all ages, and it happens to people of all education levels and all intelligence levels. So we're going to go to the next slide. In terms, many of you indicated that physical, thank you, Stephanie, many of you indicated that physical consequences are a big part of what you're concerned about. Isolation and loneliness, there are some major consequences. So if you could go through all of these. So increased stroke risk, sleep problems, more accidents in the home, increased risk of heart attack, more risk for suicide. All of these are potential, and there's lots and lots of data to support this, risk factors for being isolated and lonely. And I'm going to go to the next slide with psychological consequences. So if you're somebody, or your loved one is somebody that already struggles with depression, this time right now, this social distancing, this pandemic has really increased a lot of depressive symptoms for people who have had their depression under control, anxiety symptoms as well. But specifically for folks who are, for folks that are isolated and lonely, we see depression increase, fatigue increase, we see substance abuse increase, we see increased, believe it or not, increased risk of dementia. And then for people who already have Alzheimer's disease, we see more hallucinations. So next slide, Steph. Thank you so much. So what I want to do is give you a couple last tips for how do we have a productive conversation. Now, for some of you on this call, you might be an adult child or a niece or somebody who is encouraging a loved one to move, or you think that would be a good thing for them to do. Then there might be some of you who are older adults yourself, you're thinking of moving, and maybe some people in your family aren't excited about it. They're thinking, oh, this is the house we all grew up in. Wouldn't that be a shame to move out of it or sell it? And sadly, there even are some adult kids and family members who are concerned about the financial component. So in terms of, you know, that if my loved one stays home, that will be more financially a good idea for the whole family eventually, for estate purposes. But I want everybody to remember, if you're trying to have a conversation about when is the right time to move, or if you should move, whether you agree with the other side, whether you're an adult child trying to encourage, or whether you're the older person who's trying to say, look, this is something I want to do for myself, always remember everybody's a grown-up. In my book, Cruising Through Caregiving, I have a whole chapter that says the older loved one is an adult. We are all grown-ups, and just try to be respectful of one another. And remember, and especially when we're talking about independent living, nobody has dementia. And so an adult child, you can't force the issue. You can give your opinions, and you can talk about some of the issues we talked about today, the health benefits, the lack of social isolation benefits, and the security, the safety, all of that. Next slide, please. We want to remember that moving is always stressful. Well, almost always. Some people might enjoy moving. I've never enjoyed it myself. But what I wanted to say about that is, if you're deciding now, should I move? Should I think about it? It's always going to be stressful. I know during this COVID situation, it's very stressful, but it's going to always be stressful. And you got to weigh that pros, cons, and definitely my husband and I thought about this when we put our house up for sale. Oh my gosh, there's so much craziness going on with this pandemic. It's so stressful. Is this the right time? And we thought, well, it's always going to be stressful. And, you know, it's time that we think it's the right time right now, that the benefits potentially can outweigh the negatives. And for moving to independent living, the socialization, the security and the safety, the access to medical care on site, having all of your meals delivered, that might be worth the stress of moving right now during this difficult time. Only you and your loved one can decide if that's right for you. The next slide is, you want to decide who should communicate. So a lot of times the person who is closest to the older loved one, maybe geographically, or maybe they're the person that helps out the most, the person that's bringing the groceries or picking up the prescriptions or driving them to the doctor. Sometimes if you want to encourage your parent or your loved one to move, sometimes that person might not be the perfect person to talk about the benefits of moving. Sometimes it's better to have it to be somebody else, because it might be that your loved one can't hear it from you anymore. So think about if there's a faith community leader, if there's somebody in your family that might be a better person that could communicate all of that. The next slide, please. In terms of having a productive conversation, what's in it for you and what's in it for your loved one?
either way, so if you're an older person that's saying, you know, I do want to give this more thought, but my adult kids are really worried about the pandemic and they don't want me to move right now, think about what's in it for them. You're going to have less worry. Once I get in there, you know, there's, you know, I'm going to this community, there's either no COVID or, and they're going to, you know, I'm going to do these safety precautions for 14 days. You're not going to have to worry about bringing me my groceries or bringing me my meals or running me to the doctor. That might be what's in it for your adult child who's concerned about you. But for the adult child who's having those conversations, it might be, Mom, you know, you're not going to be lonely. Try to just to steer the conversation in. We all care about what's in it for us. And if your mom is lonely, or maybe a lot of her friends have passed away in her neighborhood recently, or in the last year, and doing social distancing outside isn't even really an option because people have either moved away or passed away. Maybe that's what's in it for her. Next slide, please. And in having a productive conversation, think about what's stressful about the move for you, but also about what's in it for them. But I also want you to think about what's stressful about not moving. What's stressful about not moving right now? What are those stressors? And I want you to go back to that number that we talked about earlier today. When we talked about that number, if you or your loved one, their quality of life is at a 40 or a 50, is moving something that's going to be able to help you during this difficult time? Is it going to take away one of your stressors, whether it's about safety and security, whether it's about physical health, whether it's about mental health? What's stressful about it, but what's stressful about not moving? So at this point, I'm going to turn it back over to Laura. Oh, please forgive me, Karen Williams. Karen Williams, I did want to mention, if you would like a free chapter of my book, Cruising Through Caregiving, please go to cruisingthroughcaregiving.com and you will download a free first chapter for free. I'm going to send this back to Karen Williams with Brightview Senior Living, and then she's going to take over the screen, and then Stephanie's going to jump back in to wrap us up and take us home. Thank you all so much. And feel free to keep putting in your questions for either Karen or I.
All right, thank you so much, Jen. I love that statement that you're saying of it's not social distancing, it's physical distancing. I think that's such a great point. So a couple questions have come up in the chat about, let's see, moving. Yeah, I mean, certainly there are challenges with making some moves into a new home. I'm going to put up share my screen again while I'm talking. You can see I don't think I can. So yeah, I mean, certainly we would need to talk about with your sales director at the specific community about how you could get your items moved into the community. When we do allow for move-ins to start taking place, it'll all be ironed out. And that's something that we're definitely looking at is how are we going to do something about that? Like, how are we going to get somebody's furniture and the things that they love to their new home with the safest way possible? So that's such a good question. So that's we're working on that. No, I can't get back to my chat. Say, someone asked about transportation. So we are highly recommending that our residents are using our physicians that are in-house, just because of keeping residents within the community and not having to venture out and potentially have contact with someone who is positive. If there is a definitive need, then we certainly still are offering transportation to specific doctors where we're not offering that within the community. And then did someone, I can't see the chat, but did somebody mention something about pets?
Hey Karen, I'm looking at the chat.
Or a
Does
TV?
not.
Pets are allowed under 40 pounds.
I'm not seeing anything, but that doesn't mean it's not
Okay.
there. Somebody just, made a statement about having some concerns with getting strangers in the house for move needs.
Sure. Yeah. Yeah. And that makes sense. That makes sense. I think, again, when the time comes for someone to make a move, we will already have covered that base and be able to ensure that you're in the safest of hands. And that really is why we are not overall doing move-ins, because we want to do it the right way. We would not want anybody to say like, yeah, I'm moving to you, and then have someone that is positive interacting with them. So we're keeping everybody safe. So with that, I know it's 1 o'clock. I do have my information back up here. There were some other questions, but please don't hesitate to email me or call or text on my cell phone. Again, I know that, thank you so much, Jen and Stephanie. It's a challenging time with deciding on when the best time to move is. Definitely, and certainly we are happy to answer any questions, and please be assured, I love that somebody asked about, are we a nursing home or are we not? And we are not a nursing home. So please rest assured that those statistics that you're seeing do not have anything near to do with what we're experiencing at Brightview. The things that you mentioned as far as using your mind, volunteering, your health, staying social, staying physically, mentally healthy, those are all things that quarantine, physical distancing or not, our residents are getting that at the community. Okay, so with that, I'll stop talking, and hesitate to email me or call. And thank you so much, Jen and Stephanie. It was a great hour.
Great. Thank you so much, Karen, for hosting, and thanks to all that joined in and the great conversation that we had today. I wish everybody a safe and healthy rest of your day. Thanks again to Brightview for sponsoring us and having this conversation. Be well, stay safe, and we will see you soon on another program, hopefully. Have a good day, everybody.
Thank you. Take care.
You too.